Kei ngā pito katoa te motu, tēnei te reo pōwhiri kia koutou katoa. Nau mai, hara mai ki tōku whare, ki tēnei kaupapa hau a mātou o te manatū hauora. Mauria mai o koutou whakaaro, hei rau atu ki te kete hauora, hei painga mō tātou katoa o Aotearoa whānui. Tēnā tātou katoa. Expanding Māori access to and choice of primary mental health and addiction services was a key need identified in He Araoranga, the government inquiry into mental health and addictions. The Ministry has established the Expanding Access and Choice program to allow for this initiative to be implemented. The program seeks to expand access to primary mental health and addiction services that will better meet the needs of all New Zealanders, especially those who experience inequities in mental health and wellbeing, including whānau Māori, rangatahi and Pacific peoples. This procurement process follows a new Kaupapa Māori primary mental health and addiction services as part of that wider program. The Ministry held a series of hui around the motu, encouraging whānau Māori, Māori organisations and tangata whaiora to discuss and work on designing new Kaupapa Māori community-based mental health and addiction services. The hui enabled participants to express the experiences of mental health and addiction services. I want to thank the 700 plus whānau from across the motu who participated in these hui and have essentially helped develop collaboratively and design this initiative. You spoke and we've listened. The kōrero from our 700 whānau voices informed the Aotearoa kawa service specification for mental health and addiction services. That forms the basis of this procurement process. Drawing from these insights, we have decided upon a required service philosophy, design, development and implementation based on the 7 major elements of te kawa. These are being whānau-centred, delivering for Māori by Māori, kaupapa Māori principles and practices, strength in te reo Māori, skill in tikanga, depth of knowledge in mātauranga Māori, and experience in rongoa. I'm very excited about this initiative and am heartened that the procurement process now allows for te reo Māori submissions and also allows for a component of oral submissions by video. Both are first for the Ministry. In addition to approving the submissions process, we have created a second stream called Teina for smaller or less experienced organisations to submit their service ideas. This Teina incubator stream will have a slightly longer time frame compared to the main tuakana and will involve innovative approaches for supporting Māori organisations who have their idea shortlisted for further consideration. I'm thrilled to be part of this process and am looking forward to seeing the results for whānau Māori. Hoi anō, tāku mō tēnei wā, kia toa te aku mihi whakamanawa kia koutou e kuhu mai ana ki tēnei kaupapa hau a mātou. Nau mai, hara mai, tahuti mai rā. I will now let our team talk in more detail about the service and procurement process.
Kia ora koutou katoa. Warm greetings and welcome to this exciting registration of interest process. The Ministry of Health is inviting providers to submit registrations of interest for the provision of new primary mental health and addiction services for our Māori whānau. In this video, we want to provide you with an overview of some of the key points about this ROI process. But please do read the full ROI document because it provides you with everything you need to know for submitting your proposal. And this video is just a brief overview. So, some key points about this ROI. We're looking to fund new primary mental health and addiction services for Māori. These services will often be the first point of contact with our mental health and addiction sector. And therefore, it's really important that the services are easy to access, warm and welcoming. With this process, we're seeking new and innovative approaches to service delivery. The funding is for Kaupapa Māori services for whānau with mild to moderate mental health and addiction concerns. So that's people who don't meet the criteria for our secondary mental health and addiction services, but are still requiring some form of formalised support. They need some extra support on top of that they can get from their friends and whānau. We're seeking registrations of interest for comprehensive service models. And by that we mean services that offer a range of supports, including evidence-based talking therapies, assessments and treatments, as well as access to social supports, peer support, and importantly, cultural support and self-management support. As John mentioned earlier, we have 2 streams for you to choose from: tuakana and teina, which is our incubator stream for smaller or less experienced providers. My colleague Maraea will give you an overview of how these 2 streams work shortly. We're looking for services that are based upon a holistic approach to mental health and wellbeing and include a Māori worldview and Kaupapa Māori values. The aim is to promote early detection and early intervention to make it easier for whānau to get the help they need when they need it, and to have a for Māori, by Māori service approach with services that are delivered in a culturally appropriate way. That's why this ROI is open to Māori-led organisations. They could be NGOs, PHOs, or any other type of organisation. They must be predominantly governed and managed by Māori and have an appropriate level of Māori employed and delivering services within their organisation. I just want to remind you that this ROI process is the first step in a 5-year program of work to expand access to and choice of primary mental health and addiction services across Aotearoa, New Zealand. Funding is planned to increase each year, and the Ministry expects that there will be further opportunities to respond to other RFPs for Kaupapa Māori primary mental health and addiction services over the next 4 years. I'll now hand you over to my colleague Maraea to outline the 2 streams and to talk about some of the key features of the process that we hope will make it easier for you to participate in this ROI.
Kia ora. As John and Joe have mentioned, this procurement process has 2 stream options, tuakana and teina. Our approach recognises that large agency government procurement processes can be daunting for many potential providers. We aim to make participation easier for a range of Māori service providers while maintaining a robust and compliant government procurement process. Tuakana, that's the established stream of this ROI, is open to suitably qualified Māori-led respondents, including NGOs, PHOs, companies and other legal entities who will have previous or existing delivery experience within the mental health and addictions field. Tuakana stream is best suited for established Māori-led providers with well-developed proposition or services. Successful respondents within the stream will have previous or existing delivery experience within the mental health and addiction field or in any other health, disability or social service. It's important to note that the tuakana is initially focused on 13 regions around the country. They are Northland, Waitemata, Auckland, Counties Manukau, Waikato, Lakes, Whanganui, Mid-Central, Hutt Valley, Capital and Coast, Nelson Marlborough, Canterbury and Southern. Teina, incubator stream of this ROI, is open to new and or smaller providers. While successful respondents within the stream may not have previous or existing delivery experience within the mental health and addiction field, they may have previous or existing experience working with Māori in another, for example, social services or rehabilitation field. Or they may be new and or smaller providers with strong ideas that they believe will make a difference to primary mental health and addiction outcomes for Māori, but would benefit from further support to get them contract ready and service delivery ready. Teina Stream is our incubator for new, smaller Māori-led providers with propositions that are developed, but would benefit from further support to get them contract ready and service delivery ready. Unlike the tuakana stream, respondents can submit ROI for services anywhere in Aotearoa, and the process timelines following the closing date are over a longer period. One of our objectives for this ROI has been to make it easier for you to participate in this process. It's also been really important to us that it's grounded within the process of Kaupapa Māori. That's why we are providing more options for prospective providers across both streams to share your ideas with us, including options to submit your ideas via a short video made on your phone and through supporting bilingual submission options. Submitters can choose to partially or fully present your proposal in either te reo Māori and or English, or a combination of both. Shortlisted participants will then be invited to participate in the next stage of this process, including presenting their service ideas in more detail at Wānau whakamarama. The ROI document, which you will already have, provides a lot more detail about the background to this initiative, what type of organisations are eligible, what your proposal should include, and the next steps. The closing date will also be in those ROI documents, including other important information. Nō reira, e ngā raurangatira, tēnā koutou, tēnā koutou, tēnā koutou katoa.